All right, Nick, my name is Eric. I'm a nurse practitioner student. Can I get your verbal consent to do videotape an abdominal exam, which my instructor will watch and then erase?
Yes, absolutely.
Okay. So I've already sanitized my hands. Okay. All right, so Nick, first thing I'm gonna do is inspect your abdomen. Do I get your permission, or can you lift up your shirt?
Sure.
Thank you. Okay, good. All right, so I'm inspecting the abdomen first, looking for any abnormalities, symmetries, any type of sclera, jaundice, any type of pulsations, any type of skin issues, any protuberance, roundness of the abdomen. Everything looks symmetrical. Next thing I'm going to do is auscultation of the abdomen. I'm going to auscultate the 4 quadrants. Okay, Nick, I'm going to place this stethoscope on your stomach. Okay, I'm just going to listen to your bowel sounds. Okay, we're going to start with the right upper quadrant. And I'm going to switch and use the bell. On the left upper quadrant. Switch and go to the bell. Left lower quadrant. And to the bell. Right lower quadrant. To the bell. Now he had normal reactive bowel sounds. If there are hypoactive, I'd actually have to listen for 3 to 5 minutes. Okay, next thing I'm going to do is I'm going to actually listen to the liver, see if there's any friction rubs. So I'm going to go right, sorry Nick, my hands are a bit cold.
That's okay.
Right at the costal margin. Actually use the bell first. Don't hear anything, any rubs, diaphragm. Next, I'm going to go over to the spleen, which is basically on the anterior margin of axillary line, about the 10th rib in, intercostal space. No rubs there. No rubs there. Next thing we do is listen to the abdominal aorta, which is above the umbilicus. Listen for any bruise. Good. Diaphragm. And then listen to the left renal artery. No bruise there. Bell. No bruise there. Right renal artery. No bruise there. The bell also. Next, I'm going to auscultate the right iliac artery. Issue the bell. And left iliac artery. Bell. Next, I would also auscultate the femoral artery, which is down in this area. The inguinal area. And the left femoral artery. Okay. Next process in the abdominal exam is percussion. Okay. So I'm using my fingers to tap your 4 quadrants. Okay. Just like this. Not going to hurt. Okay. Okay. Start with the right upper quadrant. Hands a little bit cool again. One here is tympany, a resonance. Just what you do here. That was the left upper. Now left lower quadrant. right lower quadrant. Tympanic, good. Also going to palpate over the bladder. It should be tympanic. If it's dull, that means there's bladder distension or overfilled bladder, basically. Or if it's a female, it might be an enlarged uterus if it's dull. So it should be tympanic. Which it is. Okay, next part of the percussion is I'm actually going to percuss the span of the liver. So I'm just going to use a marker right here. It's going to wipe off easily, Nick, okay?
Sure.
So what I'm going to do is I'm going to start from the umbilicus, go up to the mid-clavicular line. It should be tympanic. When I hit dullness, that'll be the lower border of the liver. When it's dull. Tympanic. Dull. Here. I'm going to start from above here now, in between the intercostal spaces. And it's dull about right here. So that is about 6 centimeters, which is in normal limits. Should be about 6 to 10 mid-clavicular line. Next organ I'm going to percuss is the spleen. Okay, that's going to be the anterior axillary line. And it should be about the 10th intercostal space. So 12, 11, 10. It should be tympanic, which it is. Now go ahead and take a deep breath in. And it still is tympanic. If it was dull, on inspiration again, that means it can be indicative of a splenomegaly. Okay, next part of the exam is we're going to do palpation. So I would start with light palpation in all 4 quadrants. So this feels for any type of masses or irregularities. Okay, next step is deep palpation. So I'll go a little bit deeper. And I'm looking at also reactions, see if there's any voluntary guarding, any grimaces, facial expressions. No, everything feels normal. Next part is I'm actually going to palpate the inferior border of the liver. It should be palpable. Okay, so what I'm going to do is I'm going to place my hand right here, pull up through here. Okay, just take a deep breath in. Yep, and I can feel the inferior border of the liver. Okay, next palpation is of the spleen. Same thing. Take a deep breath in. Good. And I do not feel the spleen. You should not be able to palpate the spleen. If you had splenomegaly, then possibly you would be able to palpate the spleen. Special test called Murphy sign, which is indicative of cholecystitis, is I would come in, again, at the calcium border, take a deep breath in, and if I pushed in and it caused a lot of pain, that means indicative of cholecystitis. Another test I can do with palpation is try to palpate the kidneys. It should not be palpable. I'll start with the left kidney, through here. Okay, you're going to take a deep breath in, and then exhale, and push. And no, I cannot feel the left kidney. And right kidney now. Breath in, exhale. And I cannot palpate the right kidney also, which is normal. Now, special tests, what I can do for indicative of appendicitis is there's McBurney's point, which is about 2/3 of the way from the umbilicus to anterior iliac spine. Over here. There's any tenderness in there. Okay. Also, a special test is hour to push in and then let out, and you cause elicited pain. That's indicative of appendicitis also. There's also called a Rosin sign, which is palpating the left lower quadrant. That will cause pain at McBurney's point. That's indicative also of appendicitis. Another special test we can do for appendicitis is obturator sign. I'll bring his leg up, and I'm actually going to internally rotate his knee or his hip. And if there's appendicitis, that would be positive also. Another test is an iliopsoas test. A couple ways you can do it. Go ahead, lift up your leg, push up against my hand, your knee. That would cause pain. Also, Nick, go ahead, lie on that side. or if I passively bring his leg back, that would cause pain in the appendix, which is indicative of appendicitis. Okay. Go ahead and sit up now. It's also a test for kidney or pyelonephritis. What I actually do is come at the CVA border, costal vertebral border, and I would actually do a direct palpation or percussion. That would cause pain or elicit pain, if it doesn't. And for left kidney also right here. Cause any type of pain. No pain there, right?
No, sir.
Okay. That will conclude our abdominal exam. Thank you, sir.
Thank you, doctor.